Hello, my name is Jatczak, and I'm a general obstetrician and gynecologist with U of L Health. So I can think back to kind of growing up, and I was very interested in math and science. And I always thought, oh, I'm going to be an engineer one day. Never had anyone in my whole family that was in the healthcare field. And then ultimately, as I was going through school, I was like, wow, the human body is amazing. And then I ultimately stumbled on OBGYN because I was like, women are so strong, I could never do that. This is fascinating, I have to know more. So I'm a general obstetrician and gynecologist with the Department of OBGYN and Women's Health, and so we do everything. So you come in from kind of birth and pregnancy, birth control, surgeries, everything. I mean, we, as a general OBGYN, we see it all and do it all. So I think you have to take a well-rounded approach. You have to bring everything that the patient brings to the table, whether it's their history or their physical exam or things that they're complaining of that day. You have to take everything into account as you're helping take care of them, because a lot of things are very complex and they need a provider that's going to help navigate all those complexities. I think that it's also great that we have the U of L Health system. So I have all the experts that are down the hall, across the way. I trained under those experts, so they're all a phone call away. So if you need coordination of care or a consult or someone, we have that ability to get you seen by them very quickly. Fun fact about myself, I just started playing pickleball. So that was something I always loved, playing racquetball and tennis and things kind of growing up, and I recently found that there's a huge Louisville pickleball community. And so if I am not working and it is not freezing cold out, I'm trying to be out on the courts and playing and just learning everything I can about it. My wife and I also just had our first baby, and so I've been spending a lot of time kind of seeing things from the other side, because I think that, for a while I just always went over, well, this is what I learned, this is what I learned. But now that I've actually lived it on the other side as an OBGYN who's gone through as a partner, I think that's able to help me kind of talk to people and help me kind of relate to people, because I have kind of lived that experience being the patient's partner on the other side, which I think was very, very interesting.